Good day, sir. So my name is Kathleen Perez, and with Ms. Karen de Guzman, we present and discuss our second topic, which is the pregnancy and lactation. In the introduction, discussion of pathophysiology of the disease, signs and symptoms, and possible consequences or complications of the disease and treatment guidelines for the disease. In the pathophysiology of pregnancy and lactation, several lines of evidence of preclinical models indicate the presence of long-lasting consequences of prenatal stress exposure, which include alteration both at behavioral and molecular level. For example, several paradigms of prenatal stress: first is restraint stress, forced swim stress, overcrowding, exposure to bright light, and food deprivation has been associated with the development of inhibited behavior in the offspring, such as a reduced activity in the field test, a reduced social preference, and an enhanced anxiety-like behavior in elevated plus maze and light dark bugs. Lactation is the process by which milk is synthesized and secreted from the mammary glands of the postpartum female breast in response to an infant sucking at the nipple. The breast milk provides ideal nutrition and passive immunity for the infant, encourages mild uterine contractions to return the uterus to its pre-pregnancy size, and induces a substantial metabolic increase in the mother, consuming the fat reserves stored during pregnancy. However, when continued breastfeeding, baseline prolactin will decrease over time to its pre-pregnancy level. In addition to prolactin and oxytocin, growth hormone, cortisol, parathyroid hormone, and insulin contribute to lactation. Part of facilitating the transport of maternal amino acids, fatty acids, glucose, and calcium to breast milk. By suckling triggers sensory nerve impulses in areola, the brain receives sensory impulses from areola and releases oxytocin from the hypothalamus and posterior pituitary. And the lactocytes in mammary alveoli produce milk in response to sensory nerve impulses. To oxytocin triggers myoepithelial cells to squeeze milk from alveoli, so it drains into lactiferous ducts. Signs and symptoms. Most commonly symptoms of pregnancy, of course, missed period, breast soreness, increased basal body temperature, morning sickness, frequent urination, and fatigue. Also, there are different types of pregnancy complication. First is gestational diabetes. This is a type of diabetes that occurs only during pregnancy. Like other diabetes, gestational diabetes also affects how your cells use sugar, and this can cause like high blood sugar that can affect pregnancy and baby's health. Second one is listeriosis. This is a serious infection caused by the germ Listeria, and this can affect pregnant women and newborn. Typically experience only fever and other non-specific symptoms like chills and headache. Toxoplasmosis. This is an infectious disease caused by parasite that passes from animals to people. So if a pregnant woman who become infected in this infection, there is a chance that she can pass the parasite to the unborn baby. Ectopic pregnancy. This is when a fertilized egg grows outside of the uterus, causes the egg gets stuck on its way to uterus, often because the fallopian tube is damaged by inflammation. Placenta previa. So this is when the cervix begins to thin out and open up the blood vessels connecting the placenta to the uterus may tear, and this can cause severe bleeding during labor and birth, and the mother has a high chance of endanger also the baby. Mastitis. So this is when the breast becomes swollen, hot, and painful. This is most common also in breastfeeding women, and thus a lot usually need a medical treatment. Urinary tract infection. UTI is a common bacterial infection that women develop during pregnancy and most frequently encountered. Placental abruption. This can cause bleeding in the mother and may interfere with the baby's supply of oxygen and nutrients. Preeclampsia. Uh, this is also a serious medical condition that can occur after 20 weeks of pregnancy and can cause high blood pressure and affect several of your body organs including the liver, kidney and brain, and if left untreated, it can lead to a serious problems for the mother and the baby. And the last one is preterm labors. This is a 37 weeks of pregnancy and a process the body goes through to give birth can also lead to premature birth. The common breastfeeding problems. First is sore nipples, most common. Second one is breast engorgement. That is happens when milk isn't fully removed from the breast. Third one is plugged milk ducts. Plugged milk ducts that the mother feels like her breast is tender, sore lump or not, and it happens when a milk duct does not drain properly. Low breast milk supply. An overabundant supply of milk that happens when a mother makes more milk than her baby uses. So the clinical guidelines of this study is the clinical practice guideline for care and pregnancy puerperium, guidelines for diagnostic imaging during pregnancy and lactation. The actual patient case. Laura Levington is a 44-year-old woman who reports experiencing 2 or 3 episodes of nausea per day with vomiting occasionally in the evenings. Her GI symptoms began about 2 weeks ago and have remained consistent, preventing her from going to work around the same time that her GI symptoms began. She started having a frequent painful urination and was diagnosed with a UTI. She is on day 5 of 7 of antibiotic treatment with nitrofurantoin. She states that she feels run down all the time and needs to start feeling better soon or she will lose her job. In addition, she is extremely concerned about her blood thinner medication, remembering that she could not take it with her previous 3 pregnancies due to the death of her brother years ago. Laurel was prescribed an antidepressant and is currently stable, no depressive episodes for the past 2 years. She also eats well, exercises, and admits stopping her birth control due to weight gain. The subjective information of the patient. First is she experiencing 2 or 3 episodes of nausea per day with vomiting occasionally in the evenings. Her GI symptoms began about 2 weeks ago and have remained consistent, preventing her from going to work. And she states that she feels run down all the time and needs to start feeling better soon or she will lose her job. While the objective information, she started having a frequent painful urination and was diagnosed with a UTI. She is extremely concerned about her blood thinner medication and she was prescribed an antidepressant and is currently stable, no depressive episodes for the past 3 years. And she eats well, exercises, and admits stopping her birth control due to weight gain.
In the continuation of Miss Perez's discussion, let's now discuss about the patient assessment. So we assess that the pregnant woman need an adverse drug reaction and need additional drug therapy. Why? It's because the 44-year-old woman is dealing with numerous problems as a consequence of her bearing a child at a late and risky time. She mentioned several indications and symptoms that would make her condition comparable to a severe case of pregnancy because the patient was mentioned in the case scenario as being required to take her blood thinner and antidepressant medication to manage her depressive disorder and prevent having a blood clot, but she didn't mention any involved drugs. We conclude that the patient may experience a drug therapy problem, such as an adverse drug reaction and need additional drug therapy. The patient also states that she has uncomfortable urinating and but no medication is indicated for treating this issue. So, for patient impression, the preceding signs and symptoms implying that the hormonal imbalance is likely to cause occasional morning sickness during pregnancy and UTI while carrying a child. The mother's health will be seriously affected by a constant nausea and vomiting as she lost a lot of fluid through excretion and dehydration could occur. Pregnancy frequently result in UTIs. This may be due to the fetus growth exerting pressure on the bladder and urinary tract. Moreover, it results in urine leaks or microbiological entrapment. So for the patient medication, so it is most likely for a pregnant woman use a heparin because it doesn't cross the placenta. So its route of administration is through subcutaneous injection. So for its dose, so for adult, 15,000 to 20,000 units or 8,000 to 10,000 units. For child, it is 250 units. For elderly, lower dosage may be required. So for the duration of this therapy, twice a day, every 8 to 12 hours. So what are the expected outcomes and when will this outcome be reached? So heparin prevents the formation of a new thromba and enlargement of existing clots. It does not dissolve formed clots. Heparin blocks the conversion of clotting factors pro- prothrombin to thrombin and fibrinogen to fibrin. So what are the possible side effects and adverse effects? So annual bruising or bleeding, vomit that is bloody or looks like a coffee ground, stool that contains bright red blood or is a black and tarry blood in urine, excessive tiredness, nausea, vomiting, chest pain, pressure, or squeezing discomfort. So, what are the signs that the treatment is not working? So, stop using the medication and call a doctor once if you have or experience this or the following. Skin changes where the medicine was injected. Second, fever, chills, runny nose or watery eyes. Third, easy bruising, unusual bleeding, purple or red spot under your skin or signs of a blood clot, sudden numbness or weakness, problems with vision or speech, swelling or redness in the arm or legs. So, it is the second medication for the patient in the management of the UTI. So, nitrofurantoin, it is an antibiotic that manage UTI. So, its dosage form is through capsule. Its dose and dosing interval, so for adult, as immediate release preparation, 50 milligrams 4 times daily. As a dual release preparation, 100 grams 2 times a day. So patient with severe chronic recurrent cases as immediate release preparation, 100 milligrams 4 times daily. So for child, use as immediate release preparation, less than 3 months, 3 milligram per or kilogram daily in 4 divided doses as a dual release preparation, less than 12 years, same as adult dose. So the duration of this therapy for adult and child both are 7 days. So because it is an antibiotic. So what are the expected outcomes and when will this outcome be reached? So treatment or prophylaxis of uncomplicated lower urinary tract infection. In women with current urinary tract infection, it may decrease the number of episodes. So here are the possible side effects and adverse effects. So nausea, vomiting, loss of appetite, heartburn or gas, hair loss, headache, rashes, hives, difficulty of breathing or swallowing, swelling of the eyes, face, mouth, lips, tongue, or throat, fever or chills, and chest pain. So, signs that the treatment is not working. So, tell your doctor right away if you have any serious side effects, including headache that is severe or doesn't go away, new signs of infections such as sore throat that doesn't go away, fever, easy bruising, bleeding, mental or mood changes, and vision changes. So here are the counseling points while taking this medication. So this drug may cause dizziness and drowsiness. It affected do not drive or operate machinery. This drug may cause yellow or brown discoloration of urine. So administration of this medication. For nitrofurantoin, it should be taken with food, with or immediately after meals. For heparin, heparin comes as a solution to be injected intravenously in the vein or deeply under the skin as diluted solution to be injected into intravenous catheters. Heparin should not be injected into a muscle or it can administer through subcutaneous. So what are the drug interaction for this medication? For heparin, enhanced anticoagulant effect with other drugs affecting platelet function or the coagulation system such as platelet aggregation, inhibitors, thrombolytic agents, salicylates, NSAIDs, vitamin K antagonists, dextrans, activated protein C. Decreased anticoagulant effect with glyceryl trinitrate infusion, increased risk of hyperkalemia with ACE inhibitor or angiotensin II antagonist. For nitrofurantoin, reduced rate and extent of absorption with antacid containing milligram of trisilicate, increased serum level and toxicity, and decreased renal excretion with uricuric drugs. Antagonistic effect with quinolone antibacterials, decreased antimicrobial effects with carbonic anhydrase inhibitor, and may diminish the therapeutic effect of norfloxacin and live polio vaccine. So here are the possible solutions. So for the nausea and vomiting, the goal of treatment is to lessen the severity of symptoms because there isn't a known cause for nausea and vomiting during pregnancy. So changing one's diet is the first step in the symptom prevention. So for painful urination, um, at the first indication of uncomfortable urination, consult your doctor. Antibiotics will likely be recommended by your doctors, particularly if it turns out that you have a UTI. We treat UTIs pregnancy quite aggressively because they can progress to kidney infections or worse. The patient must take a following precaution to avoid getting a UTI. So don't hold in your urine. Always wipe from from front to back to prevent bacterial from entering the vagina. Empty your bladder before and after having sex. Wearing breathable cotton and underwear. So for blood clot, you have a higher chance of getting blood clot if you are pregnant or just gave birth. Pregnant women are more likely to develop blood clots in their pelvic region or deep legs vein. So it may lead to a life-threatening condition known as pulmonary embolism is brought when a DVT fragments enter the lungs blood arteries. So they can also avoid miscarriage when a woman is depressed. So what are the recommendations for this patient? So we recommend for the patient to eat small, frequent meals of plain foods that are high in carbohydrate and low in fats. Second, we recommend for the patient to stick to a bland diet. Also drink cold, clear, and carbonated or sour fluids and drink this in a small amounts. And then we recommend medications such as antihistamine, dopamine antagonists to manage excessive episodes of nausea and vomiting to prevent into severe and vitamin B6 is safe. An over-the-counter treatment that may be tried first for nausea and vomiting of pregnancy, and also antibiotics for the UTIs during pregnancy to treat the infections, and anticoagulants that stop blood from clotting to treat the blood clot of the patient, such as low molecular weight heparin, and lastly, monitor the patient's urination to avoid some infections. Thank you. That's all.